Good afternoon. I am so excited that you are all able to join us for our second Women's Health Forum. It is incredible to see, this amazing group of people coming, and clearly this is a community that supports education. We could not have done this without the support of some very special people. I'd like to thank the Wolperts and Granite Rock for their support of this educational program, and Jim Batterson, our executive director, was kind of the slave driver and got all of the speakers together. Marcia Stefanik, who is our associate director, and will be giving a couple of lectures today. So if you get a chance to go hear her, she's a wonderful speaker, like all of our speakers today. And I'd like to just thank all the mothers who are here today. We just had Mother's Day, and it's nice to have my mother in the audience again this year. As many of you know, Women's Health was started in 2001 as a multidisciplinary program to advance women's health and to look at the differences in the biology of men and women. And we're the only program in the medical school that actually looks at the whole person. So I think this is a really innovative program that we have. And our mission is to improve health for women through research, education, and integrated clinical care. Research for women, I think many of you know, has been a low priority, and it's really important that we focus on this because we know looking at differences between men and women is critical. So, for example, we know that the way that men present to the emergency department with a heart attack can be very different than the way that women do, or the way that a woman presents with lung cancer can be very different than a man who has it. So it's important that we advance research and support these endeavors and in our country and around the world. All the lectures today you're going to be hearing, so it's a wide range of topics. They're all going to be on our website, and I hope if you miss any of the lectures or sometimes if there's a conflict, you can go to our website and hopefully you will all go and look at those a little bit later. And I'm really proud of the group of faculty who are talking today, and I thank all of them for being part of this. So we're really, really fortunate to have Ann Firth Murray here today, and she's going to comment a little bit more about why it's so important that we focus on women and health. As Ann says, being born female is dangerous to your health. It's such a pleasure to have someone who has done so much to call attention to women all around the world. Ann is from New Zealand, but came and was educated at the University of California and at New York University, and had a focus on international health policy and women's reproductive health. She worked at the United Nations as a writer and spent several years as editor with university presses. She's the founder of the Global Fund for Women, which I know many of you know about, and it's an amazing organization. It's the largest nonprofit organization in the world exclusively funding women's rights. In 2005, she was nominated as one of a group of women for the Nobel Peace Prize. She serves on the board of many nonprofit organizations, and she is now a consulting professor in the human biology program here at Stanford. As Paul Farmer says about one of her books, the book From Outrage to Courage, it is a call to action and a prescription for turning the world right side up, something that I think we clearly need. And I would encourage all of you to order Ann's books. They're available worldwide, and they're just wonderful, very inspirational books. And with that, I'd like Ann to address us and discuss international health.
The preceding program is copyrighted by the Board of Trustees of the Leland Stanford Junior University. Please visit us at med.stanford.edu.